An anniversary that marks a change in life as we knew it.
A year ago today, the virus that causes COVID-19 came to America. And WGN medical reporter Dina Baer takes a look back at the journey in fighting a global pandemic.
We didn't have a name for it then. Last January, it was simply called the novel coronavirus. Soon, doctors identified it as SARS-CoV-2. And as people got gravely ill and deaths piled up, they named the killer disease COVID-19. We saw China panic, illness spread, bodies mount. It was December. They called it pneumonia. And at the time, no one believed the mysterious illness would threaten Americans. By January 7th, it had a name, Novel Coronavirus 2019, initially reported to be associated with seafood markets in Wuhan province.
He was hospitalized, and we're very happy to say that he is in satisfactory condition.
Then it happened. The first U.S. case in Washington state, a traveler from China. The CDC confirming the diagnosis on January 21st. That's the same day China acknowledged person-to-person transmission.
I have today declared that the coronavirus presents a public health emergency in the United States.
With the introduction of the White House Coronavirus Task Force, Dr. Anthony Fauci, head of the National Institute of Allergy and Infectious Diseases, becomes the first trusted U.S. expert to answer growing questions and concerns.
The worst is yes ahead for us. It is how we respond to that challenge that's going to determine what the ultimate endpoint is going to be.
Immediately, President Trump closed entry points in America to anyone from China and ultimately Europe. But it did not stop the arrival and spread of the virus.
We're going to continue for her to be in isolation now until we are quite sure that she's no longer communicable.
The second city had the distinction of having the second diagnosed novel coronavirus case.
A team from the CDC came to our hospital.
By early March, passengers on cruise ships are diagnosed with COVID-19. Frantic, many called home to say they were stuck at sea.
People wearing hazmat suits coming to interview and question them. That's pretty alarming.
With more questions than answers in the early days of the pandemic, there were often conflicting messages from elected officials.
As you can see, I'm not wearing a mask, and I won't be because I don't think it's necessary.
March 11th was the official pandemic designation and the launch of restrictions in the U.S. New drugs were being tested to potentially fight the growing threat.
This is a WGN News special report.
WGN devoted an entire show each night to COVID-19, documenting the growing scientific knowledge. There has been so much confusion surrounding masks, the lack of supplies for healthcare workers, and whether the public should cover up. But we did have to stay at home.
I am ordering all bars and restaurants in the state of Illinois to close to the public. We will close all K-12 schools, public and private.
The shutdowns, which were supposed to last a month, were meant to thwart the dreaded second wave as hospitals were taxed and patient deaths mounted.
These patients take a lot of work to get them better. They can get better, but it comes at a lot of manpower and cost to our providers, both physically and emotionally. So taking care of critically ill patients that you can't talk to their family face to face. You can't offer human solace like you normally would. That's been something I really wish I would have prepared better for.
We weren't prepared for the sobering sights and statistics inside the COVID ICU.
60% of people who require a ventilator will die in the ICU.
The public got an education in ventilators, as well as its first look at the image that would be emblazoned in everyone's mind, the dreaded spike protein. In the coming months, debate over its airborne transmission would reverse earlier recommendations on masks.
I wear it for the reason that I believe it is effective.
The worst of times brought out the best in people.
Prior to COVID, we were providing about 180,000 meals a week. Now we're providing more than 220,000 meals a week.
Quarantined and alone, we found new ways to connect with loved ones.
This is how we can visit right now. I love you.
The images on a sidewalk told a story.
It's a sad time, and it's really cool to see art every day.
These neighbors got a daily dose of newborn puppies.
Oh my God. I thought, oh my gosh, I bet people are losing their jobs and they can't afford to, keep their pets, and I bet there are a lot of homeless dogs out there. We took care of her for about a week, and she had the puppies 3 days ago.
The virus may have changed our daily lives, but there was hope in the next chapter.
Our task is so urgent that under Operation Warp Speed, the federal government will invest in manufacturing all of the top vaccine candidates before they're approved.
We all have a part to play in this.
The vaccine was not the only hope for immunity. By now, more and more people who survived COVID-19 were part of antibody studies revealing the infection offered future protection, and their plasma could be infused in others to help fight the virus.
If people tell me there's a chance that something in my body can help a lot of other people, I can't just sit there at home and do nothing.
Throughout the summer, tests were in short supply, as was toilet paper, as people panicked. The disease we thought would never cause chaos in this country had now changed our life as we knew it.
At this point, I've been sick for 9 weeks, heading into 10.
For some survivors, diminished taste and smell, shortness of breath, and heart ailments mounted. At the same time, mutations were identified, showing SARS-CoV-2 was changing and becoming even more contagious. Now, several new strains are under observation.
At this time, the team and I are extremely happy with the progress the president has made.
October saw the COVID threat reach the White House in a new way. A cocktail of medications including steroids, antibodies, and an anti-malaria drug and oxygen delivery. President Trump rapidly recovered after staying at Walter Reed Medical Center for 3 days. Global cases have topped 40 million. By November, the U.S. charted 100,000 cases in a single day. The rapid rise is offset by a flurry of vaccine results, all positive. Efficacy numbers begin to roll in.
We learned that the vaccine appears to be highly efficacious, almost 95%. Really shockingly good news.
By year's end, an emergency use authorization and vaccine doses begin their journey to healthcare organizations across the nation.
And we're done.
Yay! One of two.
For some, the celebration has turned to frustration as vaccine doses have rolled out much more slowly than expected. In the quest for herd immunity, we have a long way to go. Back to you.
Well,
Tom Skilling striking a sharp drop in temperatures and then maybe some snow on the way for the weekend. His full forecast is less than 10 minutes away.
and will President Biden keep